personalized medicine has had a very mixed press, and a lot hinges on how we understand and define it. And I think the definitions that Simon has proposed are actually very good, but I'll say a little bit more about that. Not because I think I should tell everyone else how to understand personalized medicine, but just empirically to see how the label has shifted a little bit, how it has been replaced more recently with precision medicine for various reasons, and how, as many people remind us, personalized medicine has of course always been personalized, and especially the clinicians in this room will know this, and many have said in the early days of personalized medicine being pushed as a concept, this was almost an insult to everyone who had tried to tailor medicine to the needs of individual patients and characteristics to individual patients. This wonderful book, which I'm sure most people in this room know, and if you don't know it, I highly recommend it. John Berger and John Moore, A Fortunate Man, The Story of a Country Doctor. This is a book about personalized medicine. It doesn't use the term at all, but if for everyone who reads the book, this is really a book about somebody who knows his patients, who knows their individual circumstances, who diagnoses, treats, and monitors, to use these contemporary words, to tailor healthcare closer to individual characteristics. So this is exactly what it is about, and this is why I think those of us who remind us that that medicine has always been personalized, saying something very important. Another point of criticism was that it wasn't about people, it was about groups. And the metaphor that was used in those days was the metaphor of the tailor-made suit and the mass-produced T-shirt in several sizes or colors. So people said, Adam Hedgecoe makes this argument as well, personalized medicine is really about T-shirts in different sizes and not about custom-made anything. What are the key components of precision medicine, of personalized medicine in the precision medicine iteration? This is the seminal slide. While we were doing in Europe, while we were doing the European Science Foundation Forward Look, our colleagues in the US did this. They, as I mentioned, promoted this notion of precision medicine, and they used a layover map to explain what they meant. Interestingly, they call it a Google map, which already outlines some of the problem, I think. Google didn't invent layover maps, but anyhow. So the idea is you have, like Google Maps, and you have this integration of different levels of data, the more stable, the more dynamic data sets, and the map that results from this is something that should lend itself to navigation, not only metaphorically, also literally. I will tell you in a moment why. So this temporal dimension, the navigation, the being able to predict what will happen in the future, is a key component of precision medicine in its vision. Another key component is that we really go beyond genomics. Genomics is an important, genetics and genomics retains a very important role, but it's no longer a soloist. It's only maybe the first violin in the orchestra, not even that sometimes. It's really about, and this is a slide from 2014, a group of bioinformatics colleagues, they say we need to bring all of this information together to create medicine that is truly, or healthcare in this case, that is truly personalized. So health records, police records, ancestry records, lab tests, credit card purchases, location data, as Simon outlined, and so all of those things, social media postings, all of this should be brought together. They consented. With consent, we cannot solve these problems. These are problems about data justice, about justice more broadly. So a collective focus on data governance focuses on other issues than merely ownership and consent. It focuses on responsibility and governance. So what does it mean? We are not accepting that the key problem is ownership and consent. We are not accepting, sorry Simon, that data is the new oil, because what does the new oil narrative do? It tells us, oh, it's out there in nature, and somebody needs to do the hard work to get the data out of the ground, the oil out of the ground, refine it, make it suitable for consumption. And of course the oil company then should be paid. They own the oil. But data is not in there, and Google is taking it out. Data is something that you create, I create by being a patient, by being a citizen, by being a user of various online and offline services. Infrastructures are created by public money. So why would some people own the data like oil? So I feel very strongly we should not buy into this data as oil narrative at all. Data is something else. Keen Birch has done very interesting work where he really shows how data are currently assetized. They're turned into an asset by some people who just say that they are. There's not even a discussion. How should we treat health data and other data? They're just seen as an asset. So this is another Nobel Prize. I mean, Nobel is the Swedish Riksbank prize in memory of Alfred Nobel. Elinor Ostrom also got it in 2009. And she has an alternative view of how we can use data. Namely, we can use data in healthcare to create better collective responses, to improve our institutions, to not stratify according to costs at the individual level. But we keep stratifying for health benefits, obviously. We can do much more than we could on the basis of data. But sometimes when we can use data at the individual level, maybe we shouldn't. And maybe we should create good institutions instead. So she said, this is a quote from her speech that she gave when she was given the prize, designing institutions to force or nudge entirely self-interested individuals to achieve better outcomes has been the major goal posited by policy analysts for governments. But extensive empirical research that she has carried out leads her to believe that a core goal of public policy should be to facilitate the development of institutions that bring out the best in humans. So this is the good old social determinants. We can use data also to improve social determinants. And here I'm really, this is coming to the end, this is now my last slide. I think better data governance as a political endeavor is necessary if we want to utilize and develop precision medicine in a valuable way. And of course we have to have a discussion about what value is. I would love to hear what you think we should say that value is. And we need, here I'm drawing upon Vogt et al. Again, we need not a techno-scientific only, but also a humanistic understanding of holism in good timing, in personalized medicine. So we need an emphasis on human contact, not machine-like efficiency. Interestingly, the Topol review goes much further in this direction than I feared it would. It's actually quite high touch, not only high tech. It's not only about big data, but also about big interpretation. And importantly, instead of targeting behavior at the individual level, which also implies choice, people have chosen to behave in an unhealthy way, instead of doing that, let's create institutions that bring out the best in people. And in many cases, this will be social determinants and human touch in healthcare as well. And without that, I think the data-driven precision medicine is not going to work, or it's going to create big harms. And this is what I mean when I say, let's not just say personalized medicine, precision medicine are dangerous or bad, but let's reappropriate what the term should mean. And with this, I thank you for your attention.